'Tis the season to be wheezin'. Let's go over our oxygen delivery methods from least critical to most critical. First, we have the basic nasal cannula. These are little nasal prongs that sit inside of the nares, used for mild conditions, mild shortness of breath, asthma, COPD, to ease the work of breathing. Risks are minor, skin breakdown, and dryness in the nose. You can use a humidifier if needed. Next, we have a simple face mask, aka the glorified nasal cannula. This is adults, and here is peds. We want to make sure we pinch the mask to fit the nose. This is good for mild conditions, but also even for mouth breathers. A non-rebreather mask, the biggest indicator that you're looking at a non-rebreather mask is if it has a reservoir bag attached. This bag should be inflated before putting on the patient, and to do this, you fluff it out, then crank up the oxygen to fill it up. Patients are essentially non-rebreathing their CO2, so they only inhale oxygen from here, and exhaling leaves from here. We use this for smoke inhalation, traumatic injuries, and when the other two have failed. We know this is a Venturi mask because of all the color options. This type of mask is the most precise oxygen delivery without the patient being intubated. We would then use a high flow. Obviously, I don't own this, but this is used for DNI patients, pneumonia, severe respiratory distress, etc. And then last case scenario, we have an ambu bag, an emergency resuscitation, respiratory failure, altered mental status with the inability to protect the airway, and we're preparing for intubation. We make sure this is positioned tightly over the mouth and the nose.